And what I'd like to share with you today is a little bit of some examples and experiences that I've had working as a public health researcher and in policy over that time. And what I'm hoping by the end of this is that you will also be able to share with me your experiences in terms of how some of these insights could fit into your work. So we've had some allusions to this already, but I would like to begin here. That our food supply chain is currently highly stressed. And it's stressed for a number of different reasons all the way up and down the food supply chain. We know that over 80% of Canadians now live in urban settings. That's been a steady increase since about the 1920s when we passed over the 50% mark. This urbanization as well has happened differently in different places. So often we think about urban health as one set of things and rural health as another set of things. But we also need to remember that rural and urban food environments, in the case of what we're talking about here today, come in many different shapes and sizes. Of course, this process of urbanization has really received a lot of attention in the health field, but we cannot forget about rural food environments as being incredibly important to this as well, and rural populations. It was already almost 10 years ago that the Senate Standing Committee on Agriculture and Forestry commissioned a big study on rural poverty. And that was largely driven by the idea of declining farm incomes as a motivator for that research. We know that we have certain ideals and kind of paradigmatic beliefs about the way our food system works, and they're different depending on what side of the table you're sitting at or what conference you're attending. We know that the supply chain funnel, as it's sometimes talked about, is being pinched largely at the supermarket purchasing desk level, so that although we have kind of a strong production sector and we have our consumers who are increasingly kind of educated and thinking about food quality, that middle of the supply chain is increasingly under stress. The places where we actually purchase food as consumers have drastically changed over the last 100 years or so. On the left we have this ideal of the small family-run business in a central shopping district in a town. And on the other side we have the hypermarket circumstance that we now see at, for example, Costco. Of course, amid all of this choice, and that we have more choice than ever, we also have hunger. So in the first presentation today, speaking to the green paper, we talked about some of this research. So I'm a co-investigator in this proof research program out of the University of Toronto. And you've already seen some of these statistics, that 1.7 million Canadian households experienced food insecurity. This is the 2012 data, which means that actually translates into 1 in 6 children in Canada, 1 in 6 are affected at the household level by food insecurity, and which means that although we have more kind of economic choice than ever around the types of foods, the quality and quantity that we buy and produce, there's a huge proportion of the population that is unable to participate in that economic system because of income constraints. We've already seen some of this as well today in Dr. Jenia's presentation in terms of that nutrition transition that's really changing kind of the impetus for production. And we've also seen some of this data on the increasing prevalence of non-communicable or chronic diseases, such that it's now seen worldwide in all across low, middle, and high-income settings, that about 20% of global mortality is now attributable to diet-related causes. Finally, when we get to the policy environment, and I spend a lot of my time with policymakers, we see that we have a whole series of barriers and silos when it comes to how we do policy in this country at a federal level and at a provincial level and at a municipal and local level as well. Agriculture is in one sector, environment is one sector, and health is in another sector, and we don't often spend enough time talking at the same tables. So after all of that depressing news, I'm here to tell you about my vision for what the future is, or one clear way forward that myself and colleagues at the Propel Institute at the University of Waterloo and at Toronto Public Health have been working on going forward. So I'm going to talk about some of the examples from our work and some of the similar work that's been happening in other Canadian city regions and local jurisdictions. And the future is local. That was the title I pitched for my talk to David. And you might be thinking that this is what I was talking about. So local production for local consumption certainly is a big piece of what we're talking about. But what I'm really talking about is actually local innovation. So local innovation, what that means is that innovation actually happens every day. Innovation isn't actually only something that happens in the R&D sector or by special people or under special structural circumstances. What we really believe in our work is that innovation happens in the everyday decision-making and adaptation that practitioners make or that people make in their lives. So in order to detect all of that local innovation, most health research today is not set up to find those pieces of local innovation that are happening in the system. So this is our approach. We look for innovations, we look for what's happening in the everyday, we test and begin to see what the effects of those innovations are on health and dietary outcomes. And the last step is to scale, to take what's really promising and what really works out of those innovations and begin to translate it horizontally and vertically across the food system. So I'm going to go through a series of 3 examples to illustrate how that works. So the first example I have here is desire paths. So this is what it is. Actually, there's some lovely ones here at the Banff Center if you're walking from our site over to this building. And a desire path is a term from urban planning and design that indicates that despite our best intentions in setting up the infrastructure in a certain way that we believe will work for a certain function, humans actually are very innovative. They'll adapt the environment to meet their function in their circumstances. And that's what a desire path is. So what we look for is we look for desire paths in the food system. And a great example of this is in Loveton Pathway in Toronto. So this is a low-income community. You can see this aerial view. It's a low-income community with lots of apartment towers that are fairly spread out. The retail density is very low compared to other areas of Toronto, such as the downtown. And the closest discount grocery store is 2.5 kilometers away. There is a closer major supermarket that's about 1 kilometer away, but the prices are certainly higher and out of the reach of many people in this particular community. So what we saw when we looked at this community was that people are ingenious. People, exactly right below the section where I've covered up now, you can see that people living in this particular apartment tower have designed and modified their community infrastructure for themselves to make it easier, although we would say less perhaps safe, for them to access their closest discount grocery store. So in speaking about this with the community organizations, the community development organizations that work with this a lot in this community and a number of similar communities across Toronto, we said, these young fellows who are going over the fence can do this, but many people who also live in that building cannot. For example, the seniors that live in that building. So, what if we decided to actually bring the grocery store to them? So this was the launch of the Mobile Good Food Market. This is a type of mobile fresh produce vending that's popping up in a number of jurisdictions in Canada and the United States. The Toronto experience is called the Mobile Good Food Market. It's run and operationalized out of Food Share Toronto, which is a community development organization that works on food security issues. Food Share Toronto already has an existing supply and distribution chain that it works with because it delivers food to community food security programs. But we said, why don't we actually take that existing infrastructure and turn it into a business model, a viable business model that can actually allow people to continue purchasing food in the economic system and in retail in their community, even despite the geographic constraints. So the Mobile Good Food Market started out as a small cube van you see here, and it was literally a mobile market because then we'd have to take everything out and set it up as a little farmer's market. But soon the Ontario Centres of Excellence funded this as a social enterprise. And as the more we began to tell this story of this new business model, the more that people got interested in it. And so soon the municipal transportation began to get involved. And so they said, well, a van is one thing, but how about if you do you have any need for these decommissioned wheel-trans vehicles that we happen to have around? So we said, yes, we would love to have those in our project. And a design firm stepped up and said, well, we know how to actually transform that into something that looks a little bit like a store. So you can see this is a little bit like the old bookmobile. I remember that used to come through Calgary, but this is a fruit and vegetable mobile that you can actually walk inside. And this is from a couple of years ago now when we had the launch in downtown Toronto. So we started out with 8 pilot communities doing the truck model. It went down actually to 5 communities over the winter as we struggled with some distribution and supply channel issues, as well as kind of winter market shopping. It's increased back up to 8 now with this newer truck model. And this has been actually so successful that the mayor, the new City of Toronto mayor, has actually agreed to make a substantial investment into the Mobile Good Food Market and provide a larger city bus, which is actually the model that's currently being used in other cities in the United States, such as Chicago, where this type of mobile vending probably originated. So the second set of examples I want to share with you is thinking about retailers as health champions. So similarly to kind of some of the existing presentations that we've had here today, we've talked about how actually certain players in the food system can tend to be vilified, or there's a sort of a black and white, and we're painted in certain kinds of blame for certain difficulties or problems in the food system or in terms of health outcomes. But we said, what if we actually think about those retailers in the system and actually the business development challenges that they also face, and what if we begin to rethink this through a health lens? So a great example of this is this pharmacist who's in Badek in Cape Breton. I don't know if any of you have kind of seen, there's been a little bit of media coverage on him. But Graham is a pharmacist, and he runs this particular store in Bedeque. And what he decided to do is he said, I'm tired of actually selling sugar-sweetened beverages and having people ring that through at the cash at the same time that they're ringing through their prescription. So that paradox was kind of really present to him every day in terms of being a small business owner who is kind of coordinating that whole connection between the producer and the consumer. So what he decided to do was actually to pull all the sugar-sweetened beverages out of his store and actually use the cooler to only provide water and unsweetened beverages. So he's received a little bit of attention about this. My colleague Lam Miniker at the Propel Institute is now beginning to work with the municipality of Bedeque, and including the Needs store, which is one of the major stores in that town, to look at actually how this has affected sales. Because at the end of the day, it's no good to our population health if the store goes out of business as well. So we think this is really an important kind of piece to analyze side by side, both the sales effects and the effects on the local economy, as well as the potential dietary and health impacts of these types of innovation.